Hi everyone, Dr. Michael Miyazaki here again, and I thought today we talk a little bit about endodontic irrigation, but maybe in a little bit different way. Talk about some of the kind of the adjunct materials again that are available to make life easier. And I will tell you, if you're not doing endo procedures in your practice and you're a general practitioner, I think it really is a service that you should add. Patients really appreciate it when you can do their root canal every day. As restorative doctors, we get in there, we never know what we're going to find inside of a tooth once we remove all the decay. I think it's good for us to have a plan. If we're close to the pulp, once we remove the decay, what are we going to do? If we've hit the nerve and exposed the nerve in removing the decay, then what are we going to do? And put yourself in your patient's shoes. If you went into the dentist and it's a dentist that you trust, that you like, and you knew you had a cavity that was fairly deep, and the doc got in there and cleaned out all the decay, and we're scooping it out, like shoveling soft stuff out of a hole, and the doctor told you, oh, this is so deep, we've gotten into the area where the nerve is, I need to send you to now another dentist, to another office. And it's an inconvenience. You're going to be sent to an office where you know nobody, and it's just not a comforting feeling. Whereas if you could do the root canal, the patient's going to appreciate that you took the time to do the root canal for them. And so we're going to talk about some endodontic irrigation adjuncts. And one is the tip. When we are irrigating a canal, I know some of us are very nervous about taking that sodium hypochlorite and expressing it beyond the apex of the tooth. And I get it. I've told our R&D team that when I get the irrigation needle tip down into the canal and I'm squeezing out the irrigant from the syringe into that canal, it's tough. Sometimes the force, the pressure required to get it out of the syringe is a lot, and you're trying not to bind the tip at the apex because you're afraid that if you express too much, too hard, it's going to express out the apex and you're going to have a sodium hypochlorite accident. Well, one of the ways you can do this and not have to worry is use side vent irrigation tips. Now, side vent irrigation tips, some needles have one side vent, some have two side vents. The one that we're talking about today is a VIP tip, so we have two side vents. And what the two side vents allows us to do is the tip of the needle is closed. So if I get the tip down at the apex and let's say I bind it down there, well, all I'm doing is I'm just plugging that area up. Now when I express the irrigant out of the syringe, it can't go down to the apex of the tooth because we've already bound the tip down there. It's going to have to go out sideways. And so by having two side vents, the pressure that it takes to extrude this irrigant is much less, which gives me, at least I feel like, more control. So I'm able to express the irrigant out there. It goes out the side vents and it irrigates and cleanses that canal. Now with sodium hypochlorite, we can do that. With our EDTA, we can do this, and even with our chlorhexidine. So the VIP tip is a dual-sided needle with a closed tip that makes this possible. Now, some of the other nice features of this tip is it's pre-bent. So it doesn't come out like a straight needle that you have to bend. It's pre-bent. It's got the silicone stopper on it right out of the package. And this is what the dual side port looks like. So you can see that the tip, it's sealed up. So it cannot allow you to express the irrigant out of the tip beyond the apex. If you were to jam this down into the canal, this would bind down there. And then when you express your irrigant, it would just go out the sides, both sides. This cannula, I like it because I get a good tactile feel as I go down into the canal. And because it's fairly stiff, being metal, it can give me that tactile feel that I'm going down the right canal, that I'm going down the canal, and it's not binding or bending. So I really appreciate just the tactile feel. So it's got the stainless steel shoulder for zero flow impedance, and it gives you maximum visualization. It's really easy for me when you've got those canals, maybe it's 5 canals in a molar, to see which canal I'm getting into because of visibility. We've got that optimum bend for the access, flexible cannula so it can navigate the canals, dual side ports for that safety and the efficacy of being able to be expressed without offering a lot of resistance to expressing out the irrigant. The silicone stopper is our depth reference, so I don't have to put one on or guess how deep I'm putting a needle down into the tooth. And it has a secure lock hub so that when you place it on your syringe, it's not going to pop off. You don't want to do that, especially if you're using sodium hypochlorite where it gets all over the patient, which could be very dangerous, but it's going to destroy the clothes. So this is a very nice tip to have. Now, you have to understand the way this was designed was to have all these features, but then to minimize your inventory. So it comes in two lengths, a 17 and a 27. If you've got a tooth that's let's say a 21 millimeter long canal, the 17 millimeter tip should do you, because you don't have to get the tip all the way down to the apex, especially if you're using the endo activator, because that's going to help get the irrigant down towards the apex. Now remember, because I get this question asked a lot, does the endo activator force the irrigant past the apex? It does not. What it's going to do is it creates cavitation that actually causes the irrigant to go down and then come back up along the canal. So it does not force it beyond the apex. But this tip, the VIP tip, was designed where you can have two different lengths. It's one gauge, 29. Big enough to get the irrigant out, but small enough to get down to the bottom of your canal. Now, some of the doctors I talk to are concerned. They'll say, well, 29, maybe they use a 31 or 25 or 27, whatever it may be. But the way that this is special is that it has a very small outside diameter, and being smaller on the outside diameter means it can get into the canals easier, and then it can get down into the small narrow canals deeper. But it still has a large internal diameter, and because there's a large internal diameter, that means that we can express out our irrigant well. Because imagine you have a small inside diameter and you're trying to squeeze the irrigant out. Well, through a small tube, it's going to take more force. So having this VIP tip as your irrigation tip works really well. You don't have to have a lot of tips. It's 29 gauge. It's going to do good in large canals and small canals. And if you're doing a lot of long canals, maybe you want the 27. I often find a 17 works really well for me. And the 17 just makes it easier to access like a second molar and get it way back there. So again, it's really designed for safety, efficiency on your part when you're doing your root canal, and to minimize your inventory. So this is just a close-up, just a video. And here you can see how the tip looks. You got the stopper on there, and it's got the dual side ports. You can see that the hub is attached securely to the syringe. It's not going to pop off. And you can see how we have that shoulder up top, but the rest of that needle is going to be very flexible. And here's a great shot just showing how the irrigant comes out. So imagine you have that and it binds out the apex. It's not going to shoot the sodium hypochlorite down out of the apex. It's going to just extrude it out sideways. So it's going to be very safe. So you're going to avoid this. I always kind of cringe when you look at this, because this is the photo we've all seen all through our dental careers. And it was an unfortunate accident, but we want to try to avoid that. Now, there's another syringe that Vista Apex Solutions has, and it's a really cool syringe, because we don't want to get sodium hypochlorite on our patient's clothes and create a tie-dye wardrobe for the patient. So there are these 6cc dripless syringes, and what happens is when you extrude the irrigant out of these syringes, it extrudes it, but then as soon as you stop, there's a slight suck back, and so you can no longer accidentally squirt the irrigant on the patient's shirt when you're pulling it out and you've relieved the pressure from the plunger. There's a slight tug back, and that just sucks up even that drop of irrigant back into the tip. So I've had it. I think we've all had it if you do root canals, where just a drop of sodium hypochlorite gets on a patient's blouse or shirt, and if you can't wash it out in time and it discolors that garment, you've bought a new shirt or a garment for your patient. These dripless syringes with the VIP tips work really, really well. Now, some doctors that I talk to do not do a lot of root canal procedures, and so they worry about the shelf life of their irrigant. And so Vista Apex has these little kits. It's an endodontic irrigation kit, and it's called Canal Clean. And one of the nice things is they are sealed up in these little pouches like this, and the kit contains 12 milliliters of the Chlor Extra, which is the sodium hypochlorite with the advanced formulation with the surfactants, 6 milliliters of Smear Off. Remember, Smear Off is your EDTA and your chlorhexidine, and you don't have to worry about mixing your Chlor Extra, your sodium hypochlorite, with your Smear Off's chlorhexidine. You won't get that precipitate. There are two 30 gauge irrigation tips in this and one micro aspirator with a tip. And so what the micro aspirator does, it makes it very easy to dry your canals. So if you look at here, it says refrigeration is recommended. It will have a shelf life. And so you can put these in your refrigerator. They'll keep really well. And because they're sealed up so well, they will not cause any kind of smell in your refrigerator if you have to worry about that. Here's step one. It says Chlor Extra. Here's step two. It says Smear Off. You can see the micro aspirator there with the tip on there, and you just plug that onto your section, and these are the little irrigation tips. So very easy. If you don't do a lot of root canals, you can go over the instructions where it talks about step one, step two, what to do, what to use. It's all laid out there. Open up the packet, and everything you need is there. So that little micro aspirator tip, here's a micro aspiration evac set. It's just the tubing. So if you're going to use this, you could plug that tip directly into your high volume evacuator, or if you want to use this tubing, it works really well. What you do is you put that tube that has kind of a large adapter into your high volume evacuator, and with that you can adjust the amount of suction that you have going through that tube. The other end, you can put your micro aspirator on. And so one of the great things about this is when you have your rubber dam on and maybe you're using a scope or you just don't like water all over the place, you can actually use this little suction, place that in the canal where you're working, and it will suction all that moisture, debris right out of that your working field. So if you're using a microscope, it's going to keep things much more clean. If you're not using a microscope, as you're doing the irrigation, you're going to be able to suction out that irrigant with that micro aspirator. So again, it's going to keep a controlled environment there, and when you go to dry it, you're not going to need a lot of paper points. So this kit provides exactly what those GPs that are doing that occasional endo need for great outcomes, because you've got your Chlor Extra and your Smear Off. So using the advanced irrigation technique, you're going to have pharmacy fresh solutions because it has a shelf life, and you're going to open up that packet, and it really is engineered for maximum effectiveness. You're not going to have to throw away a lot of stuff if you aren't doing a lot of root canals, so it becomes very cost effective. You know, one of the things that I saw today was on Instagram, and I know all our feeds are different, was it appeared to be a young dentist. And the young dentist was describing how they were having to close their office, how they had taken so much pride in the office that they started up, that they had built, and they had the trust of all these patients. But I guess the practice just became too much to handle. Instead of being the palace, it became the prison. And one of the things I worry about is a lot of GP offices, with all the economic changes that have occurred in the field of dentistry, may feel the same way. You don't look forward to going to work. You know, running the practice is a challenge, and trying to make a profit is difficult too. One of the things that I've done over the last couple months, I've really stressed the endodontic procedures in your practice. Dr. Christensen said in a CR survey done a couple years ago that endodontic procedures should make up about 20% of our practice. So just imagine if you have a practice and you're doing $100,000 of production a month, 20,000 of that should be from endodontic procedures. Or imagine you would like to get to 100,000, but you're only doing 80,000. Well, if you up the number of endodontic procedures you were doing, you might be able to take that $80,000 practice up 20% to $96,000 by just incorporating endodontics into your practice. I also know that endodontics can be scary. Endodontics can be difficult. So what I hope you do is you're taking this information, the different irrigation techniques. The file systems are kind of universal. I haven't really talked about using one different file system, but whatever file system you use, you have to use irrigation in order to have a successful outcome with your root canal procedures. We've talked about sealers because the files help to shape the canals. In shaping the canals, you're creating a lot of debris. The debris you're using the irrigants to remove, you're using the irrigants to disinfect the canals, you're using the irrigants to dissolve the tissue and to get the activation to get into those lateral spaces. And that is when you start to achieve success. So some of you have tried to do root canals and they haven't worked out, the patients haven't healed. What I hope you do is you're taking all this information and you adapt it to your endodontic procedures to enjoy greater success. So remember, everything that we're going through isn't just here because we want you to buy Vista Apex solutions and materials. This information is because we're trying to build a community of like-minded individuals trying to achieve success in most everything we do for our patients. We want to take good, responsible care of our patients to do the best service we can. If you like this information, hit the like button. If you want to make sure you don't miss any of this information, hit subscribe. We really want to build this community and we want you to be involved. So remember, I know dentistry is not easy. Dentistry has changed. I'll give you one more kind of tip. Many of you know that starting this year, our daughter joined our practice. We didn't have a lot of time to plan. It was a little bit unexpected. So we've been trying to go into this mode of building our practice again. So we're doing more marketing this year than I have in the past couple of years. And so one of the questions was, is this in our budget? And my explanation was, marketing isn't in our budget. We're making an investment. An investment means we're going to spend today to hopefully get a greater return down the road. So I'm very excited. She's been in our practice now for 6 months, has kind of got the lay of the land, has met most of the patients. And as we go into the second half of this year, we are going to spend more on marketing and we're going to build our practice. So don't feel defeated. What we need to do is focus on what's going to make your practice more successful. Enjoy the journey and take the steps and invest in your practice, whether it be in gaining skills, getting new technology, which I've talked about in the last couple of weeks, and just trying new procedures that you may not be doing in your practice, because that is going to make you more successful. So anyway, I look forward to seeing you again in another episode coming up soon, and thank you very much for joining us. Take care.